Welcome to First. I'm Mark Eichman along with Michelle Polston. Shirley Min is off this week. AI DuPont Hospital for Children is ready to unveil a major expansion. First takes a tour and looks at the hospital's future.
And there's no future if someone is hooked on drugs. This week, First teams up with WHYY's The Pulse to go behind the scenes with those who are looking to stop overdoses.
There is still more work to be done in order to build a better future for those with breast cancer, especially in the Hispanic community. We'll look at some of those efforts.
First, your public media news magazine starts now.
As the healthcare landscape is changing, so too is the way hospitals deliver care. After more than 3 years, AI DuPont Hospital for Children is ready to unveil its massive new expansion that's designed to ease young patients and their families through tough times. For this week's First Look, we got a first-hand view of how the new facility was designed to provide comfort and care. Reminiscent of a turning kaleidoscope, the bright blue window accents rise high above the expanded campus of AI DuPont Hospital for Children in Wilmington. Inside, the expansion was designed to be an inviting place. There's art all over the walls.
Beautiful artwork in here for the children and families to enjoy.
There's interactives built into the floor.
So they can even play on the units when they're walking.
An outdoor healing garden.
Even 5 minutes just gives you a new perspective, refreshes you a little bit.
But perhaps the biggest attention getter is the interactive video wall in the lobby.
This even helps children move. So it stimulates that. So therapists will come down and it will make them want to interact and move in a different way.
Work started on the new 5-story wing 3 years ago.
It was becoming very evident that with the age of our facilities and the age of the existing hospital, that we needed to elevate to a different standard.
For years, young patients were often doubled up in rooms with 2 sets of family and friends crowding in for visits. But that will soon be a thing of the past.
The big difference will be that the rooms that the children will be cared for in will be private rooms. They will be very large rooms, amongst the largest in the country in terms of pediatric care.
The rooms are designed not only for family comfort, but also for medical staff efficiency.
This is the care team zone. This is where the nurse has space to do medication preparation, anything that the patient needs, have computers to document on. And then we have a head wall with all the necessary gases and equipment that a patient might need, and then have really the patient zone.
The rooms also have a TV for the patient and another for the family area, plus a couch that turns into a sleeper.
We have everything that we need for our care right there at our fingertips so that we can care for our children.
From the start, families were included in the plans and design of what the inside of the new structure would look like.
We were an integral part from the very beginning of what this hospital would look like and how it would work. So it was really exciting to see that not only did they just want to present it to us, but they listened to us and made the changes that we were requesting.
Lisa Stammer-Johann is a frequent flyer at the hospital, getting care for her daughter.
Her first open heart surgery was when she was about 9 days old, and then she underwent her second open heart surgery when she was 9 months old. And that stay, which should have taken about 2 weeks, was 2 months. You gonna come down the slide?
Her daughter is now a much healthier 6-year-old, thanks in big part to the doctors at AI.
She was a very high-risk case, and they even warned us that she might not make it. But we really trusted the Nemours physicians and staff that we met before she was born.
On average, about 55,000 kids are treated in the emergency department. About 250,000 visit for outpatient procedures, while there are about 12,000 inpatient stays every year. Hospital leaders hope the expansion makes all those visits more comfortable for parents and their young patients.
Without question, the design, the colors, the finishes, the experience contributes to the healing of the child. We know that, and what we want to create is a facility and an array of amenities that complements the direct medical care that we provide to the child.
And the aesthetics, believe it or not, play a huge role in the comfort that the families have, and therefore the healing that the children can experience. When parents are stressed, kids are stressed.
Typically hospitals are a place of stress, and this is one so that we can provide areas of relaxation.
And as workers are finishing up and staff are getting up to speed on where everything is in the building, hospital leaders are confident what the reaction of patients and their families will be.
Wow. I hope and I anticipate that we're going to hear the word wow. But most importantly, I think what we're going to hear is, you listened, Nemours. You listened to us.
One of the best parts about the new facility for hospital administrators, how about the fact that the $270 million expansion is already paid off? I'm told the hospital saved extra revenue generated by operations over the years, and that, along with some philanthropic donations from corporate groups and others, helped fund the construction effort.
Just a little curious, Mark, what happens to the current hospital when operations move to the new facility?
Well, when the new building opens, which should be around mid-October, that will become the home for inpatient care as well as the hospital's brand new emergency room. The current facility, meanwhile, will be mainly used for outpatient efforts as well as other hospital services. The new building is really just Phase 1 of the master plan for the hospital campus. Up next will be renovations for that existing hospital, improvements in diagnostic facilities, upgrades in areas like radiology and physical and occupational therapy.
Okay, well, thanks, Mark. For those of you at home, if you want a second glimpse at Mark's story, be sure to visit our website at newsworks.org/Delaware.
Coming up on First, a stronger push to get the message of breast cancer screenings out to the Hispanic community. And the Clayton Theater makes the transition from movie films to digital movies, and they did it the old-fashioned way.
There has been a disturbing rise in the number of overdoses from heroin and other opiates in Delaware. We have presented several stories on First behind the causes of that rise, but state leaders and advocates alike say more needs to be done. Let's bring in Ilana Gordon, a member of the WHYY Health and Science Desk, for more.
That's right, Nichelle. It's a coordinated effort among health advocates, state leaders, and even some law enforcement officials. They want to get a better handle on a situation that's now responsible for more than 15 suspected overdose deaths a month in Delaware. John Dooling, who's 36, almost became one of those statistics.
Well, my addiction took over my life, and it led me to do a lot of things, make a lot of bad choices, and waste a lot of years of my life, getting in trouble, going to prison. It grabbed a hold of me at an early age. I started doing it at about 15.
But the last time he got high, he says he died for 7 minutes.
It was July 15, 2012. And me and a friend of mine, I had about 3 months clean. And my body not being used to it, I died. I actually fell out.
Luckily, Dooling was with a friend who saw him turn blue and become unresponsive. The friend called 911. Even though he was on probation.
And that was before that law got passed, and he actually got sent back to jail. But he saved my life.
Dooling is referring to Delaware's Good Samaritan law, enacted last year, that aims to give legal immunity to people who call for help when someone is overdosing. His friend's call to 911 meant access to life-saving treatment from paramedics, a shot of naloxone or Narcan, which, if given soon enough, reverses on the spot an overdose.
When they hit me with the Narcan, it was like a flash of glittering lights, and I came like right to.
Without it, Dooling says he wouldn't be here doing this interview.
We have the belief that anyone who's using opiates at any level is at risk for an overdose.
Domenica Persanti oversees prevention programs at Brandywine Counseling. She says whether a person is a long-time or new drug user, it only takes a little bit more than what one's body is used to overdose. But she says deaths can be prevented.
What do you guys know about overdose?
When her agency saw a spike in overdose deaths last fall, they started organizing trainings to educate people connected to Brandywine, such as those in treatment, on how to respond to an overdose and how to lower the risk of death.
So one of the things that we want to drive home is that people are at higher risk in certain situations. So an example of that is someone who's been sober for any period of time, even 5 to 7 days, is at higher risk of overdose than someone who's not because of their lack of tolerance.
Persanti says people who use alone are at higher risk of dying from an overdose. No one's there to help, as are people who are medically compromised and people who mix drugs. Persanti goes over with the group how to recognize an overdose.
One of the things that you can do, can I touch you? Can I lift your hand up? I always ask permission. You can lift their hand up like this and let it go. Because if someone is truly out and they're possibly unconscious, what's going to happen? Drop your hand. Drop it. It's going to do that. Yeah, because they can't. And if not, you're going to go to drop their hand and they're going to jerk, just like one of you just mentioned, and then maybe catch themselves. So if you lift someone's arm up and it hits, whatever it is, they're out, right? Somebody else said it. Blue around their lips.
And how to react. The biggest thing.
The bottom line is always err on the side of caution and just call 911.
I thought it was very helpful. I think if someone was overdosing around me, this would help a lot. I think I could definitely help save them now. My name's Austin Gilbert. I'm 24. I'm addicted to heroin.
With related deaths on the rise throughout the state, lawmakers recently enacted 2 laws aimed at reversing that trend. One would expand these prevention trainings to the community at large across the state. Persanti says that way, friends and loved ones would also have more resources. The law would also allow community members who go through the training to get a prescription to buy naloxone.
This is one of our overdose prevention and rescue kits.
That way, she says if someone is overdosing, a friend doesn't have to wait critical minutes before help arrives to get that person what could be a life-saving overdose-reversing drug.
So naloxone's really easy to use. You just pop the bottom off, push the medication in, pop the top on, and then that's it.
Well, one, it'll keep people alive. Okay, we can't do anything to help a person if they're not alive.
Representative Mike Barbieri was a sponsor on the legislation. Some critics worry that access to Narcan might embolden users to not fear overdosing. But he says the law is the first step in a much broader effort to get a handle on a growing drug epidemic and the related deaths. Barbieri is also a sponsor on another bill passed this summer that gives law enforcement the option to carry Narcan. At least 15 other states have similar programs. Colonel Elmer Setting, chief of Newcastle County Police, is on board.
Some time ago, you would have heard people say, well, why should I have to do CPR? I'm a police officer. Well, because we're the first reaction force out there. We should be equipped to deal with almost anything.
Setting says some other departments are wary of taking on an additional responsibility. He thinks both laws could reduce the number of overdose deaths in Delaware by half or more. As for John Dooling, he thinks about that day he overdosed a lot. He says it spurred some major life changes.
And that was kind of like my wake-up call. Like, that's kind of when you get into recovery, you got to hit a bottom. And that was like the biggest bottom that I've ever hit in my life.
Dooling says staying in recovery has taken a lot of work. But today, he's a community wellness advocate at Brandywine Counseling, not too far from the very spot where he overdosed.
Working at Brandywine and being a peer actually helped me. I had about 8 months clean when I started here, and working with other people going through what I went through actually helped.
Dooling says it's been a rough year. He lost 9 friends to overdoses, most recently the day before we spoke. But he finds support and hope in instances like the one he witnesses while standing outside Brandywine's outreach van. A woman walks up. She asks for help.
So someone's getting treatment. It's pretty cool.
The plan for statewide trainings to deal with the overdose situation are still in the works, but should start sometime this fall. Colonel Setting hopes to have his officers trained in the use of Narcan by early next year.
Great story, Ilana. I understand one of the causes of drug overdose death comes from the use of fentanyl. Has that use of that drug leveled off at all?
So fentanyl has recently been getting into the heroin mix, and what that means is it's much more potent. So there's been about 124 suspected overdose deaths in Delaware this year, or since November. About 12 of those have been identified as having fentanyl related to it.
Can you give our audience an idea of how Narcan works?
So Narcan is sort of this antidote for an overdose, and how it works is typically heroin, it gets in your system and it unleashes the receptors in your brain responsible for euphoria, but also slowing down your system, slow heart rate, overdose. If naloxone's administered soon enough, what happens is it gets to those receptors and it blocks the heroin from getting there, and it reverses an overdose.
Okay, well, thanks so much, Ilana, for being here. Ilana Gordon is a part of the team on The Pulse. Catch her reporting on WHYY-FM on Fridays at 9 a.m. and again on Sunday at 10 a.m. Read health and science news on newsworks.org. Shirley Min is away this week, but she did leave us our first person interview.
Joining me on set is the Adjutant General of the Delaware National Guard, Frank Vavala. Thank you so much for being here, General.
It's great to be with you, Shirley. Thank you.
Over 15 years as head of the Delaware National Guard.
Long time.
What changes? You had to have seen some changes in all of that time.
Oh, tremendous changes. Probably the largest change was really us moving from a strategic reserve to a truly operational force in the aftermath of 9/11. So our resourcing has changed. The fact that we deploy our personnel on a regular basis has changed. So there have been a lot of significant changes regarding our Delaware Army and Air National Guard.
I know you were talking about changes in the mission readiness. What does that mean for someone at home?
Well, what it means is our ability to be able to prepare for a multifunctional role, a role not only of Homeland Security, but in overseas operational capabilities. So we become a full spectrum force. We're able to satisfy the needs of the state in emergency operations and otherwise, and also to take care of our overseas commitments that we have for the United States Army and Air Force.
Now, the 238th was recently welcome home. My husband is in that unit, so very
Great
happy.
military spouse, and I'm sure you're related, yeah.
I am. Family and friends have all been asking me, is he home for good? Now, I say an Army wife knows better than to answer that question.
Yeah,
but
you probably could answer it. I can't guarantee that he's home for good because, again, it's going to depend on what our commitments are around the world. And with Army Aviation, they've been spinning on a real rapid rotation. It's been about one in every 3 years.
The rumor is active duty Army and Air Force guys are getting essentially what are known as pink slips while they're on deployments. This is all due to some of these Department of Defense cuts that are going down. And I'm wondering, with the active component downsizing, is that good news for Guard units and the Delaware National Guard?
You know, you think it would be, and as we continue to draw down in Afghanistan and other places, but not so much, particularly in the Army's case, because the Army is not only going to reduce their active component force structure, but they're looking at reducing the National Guard's force structure. Right now, we're at about 355,000 in the Army National Guard throughout the United States, the three territories, and the District of Columbia, which all have a National Guard. And they want to bring us down to 335,000. And if sequestration hits in, it's going to take us down to 315,000, which is significant. And we in Delaware could consequently lose one unit in a 335 drawdown and another unit in a 315 drawdown. So that would be a significant reduction for us. For the life of me, I can't figure out why the Army would want to bring down the Army National Guard, because when you look at us, we're a third of the cost of an active component soldier. And that has a lot to do with the fact that you use us as you need us. Our folks return to their civilian world, to their civilian jobs, and they come on active duty when they're needed.
If they downsize the active component, though, and then they want to downsize the Guard, then what's to say of this instability going on in the Middle East with ISIS? Do you see the military as a whole as at a disadvantage and the Guard at a disadvantage?
I do, because it won't take long if we don't continue to be able to get the monies for training and we don't get equipment before we start to atrophy as an Army National Guard, because we're just not using the capabilities. We need to be prepared to be able to plug in if needed to support our national objectives.
All right, well, so much more to talk about and cover, but we are out of time. General Vavala, thank you so much for taking the time to sit down with us. You can catch this entire interview online at newsworks.org/Delaware.
Check out First online. Go to WHYY.org/First. All of our shows are there, and you can watch them whenever you want. If you have Comcast, go to On Demand to watch First, along with other WHYY programs.
September is Hispanic Heritage Month, and this year, the Delaware Breast Cancer Coalition is running a campaign in conjunction with it from September 15th to October 15th. During that time, officials are determined to expand their outreach into the Hispanic community, and the move hits close to home to 2 Hispanic survivors.
I didn't even realize how it affected women that look like me until I got sick.
Olga Rosado says her breast cancer story started off a bit unusual because she experienced something other than a lump.
I didn't have a knot. I didn't have a lump. I had a swollen breast.
Rosado eventually learned it was inflammatory breast cancer and in its 3rd stage. Today, she supports the Delaware Breast Cancer Coalition's decision to aggressively expand outreach into the Hispanic community.
The estimates from the American Cancer Society say that about 113 men and women in Delaware who are Hispanic will be diagnosed with breast cancer this year.
That number may not sound alarming, but it is when you're the one diagnosed, according to Rosado. To officials, any number of women diagnosed is a concern. And so as they beef up breast cancer awareness this year, the coalition is starting with Hispanic women.
A lot of times they are diagnosed at a later stage, so their cancers might be, their tumors might be larger, their cancer might be more severe, and the Delaware Breast Cancer Coalition is trying to reach out early so that if they are screened earlier, their chances of survival are much better.
Pairing people up with those who don't speak English well is another goal. It's encouraged due to the language barrier often seen in Spanish-speaking communities. Gretel Huber, who's been cancer-free for at least 3 years, knows firsthand the importance of mentoring.
There was a woman, I'm Spanish, I'm from Costa Rica originally. There's a woman that didn't speak any English at all and was diagnosed, but in Maryland.
Though Gretel lives in Delaware, the distance didn't keep her from going the extra mile and sharing everything she went through as a cancer patient. Her mentoring helped the young woman get through the entire process.
We went the whole thing through together, and it was really, really rewarding.
Meanwhile, back at the Delaware Breast Cancer Coalition, they're also pushing for Hispanic men and women to learn more about their family health issues this month and trace it back using a family history health tree.
So it dates back 3 generations, so you can ask questions of your mother, your father, your siblings, your grandparents. Even if they're no longer living, you can ask your family about their family history.
Coalition officials say it's necessary. In fact, before Rosado was diagnosed, she lost several family and friends to different cancers.
Any women out there, don't take it lightly. Fear is there, but put fear on the shelf. Because to wake up one day and get diagnosed and told you have cancer, it can be devastating.
And if you're already fighting to survive breast cancer, Gretel wants Hispanic women to remember one thing.
Tenga esperanza, porque siempre se puede.
And what does that mean?
Have hope, because everything can be done.
Rather than just testing for lumps, officials from the Delaware Breast Cancer Coalition tell me all women, especially Hispanic women this month, need to know what's normal and what's not, whether that be a lump, swelling, general feeling of pain, or numbness. Those are all signs that you should talk to your doctor.
The Clayton Theater in Dagsboro transitioned from the old-fashioned movie projector to digital movies about 6 months ago. It was a costly process for the 65-year-old theater. Delaware's lone first-run single-screen movie theater has come a long way since One Touch of Venus was first shown in 1949. First Experience goes to the movies for a review.
The Clayton Theater was built in 1948. It opened its doors on February 2nd, 1949. The first movie they showed was One Touch of Venus. It was owned by 2 brothers-in-law, Pete Hancock and Skeet Campbell, and they built and ran the theater till 1975. We're the last remaining single-screen theater that's still in operation as a first-run cinema in Delaware. We're just celebrating our 65th anniversary. The theater has pretty much remained the same. We relit the marquee on the front of the building. We did some painting, and over the years we've made a few adjustments. We put in new draperies on the walls, put in new seats, but basically the theater is pretty much the same it was when it opened in 1949. This year, however, it's going to be different. Studios have announced that we will no longer be able to get 35mm film. So we worked all of 2013 to raise the funds to help us switch over to digital projection. There were all sorts of little connections along the way that just made us feel like we were destined to take over the place. The theater was named Clayton, which was my father's name. There's a big original poster from the Sands of Iwo Jima with John Wayne. Well, it just so happens that my father fought on Iwo Jima. The daughters of the original owners came by to see a film, and they brought me a copy of the original flyer from the day the theater had opened on February the 2nd. That's my birthday. It was like destiny.
My father, Pete Hancock, and my uncle, Skeet Campbell, thought about investing in some beach property. And so in 1948, the construction started. I remember coming to opening night. I was 5, going on 6, and the crowd was such that they broke the hinges on the doors and also trampled my mother's shoes.
We would come in, get on the stage, and sing the songs that some of the singers at the time were singing. We'd go upstairs to the bathrooms and we'd walk down the stairs as if we had on these beautiful sequin gowns and introduce each other. This is where you met your friends from school on the weekend. Sat with my first boyfriend here, had my first kiss here, dates brought me here.
It makes me feel very proud that people still like to come here. It's just an awesome thing to think that this has been here 65 years. It's just been my life.
I just love the nostalgia of it all, and our popcorn is freshly made, it's hot. It's just a fun experience.
This past summer, the theater was honored as a Delaware Historic Landmark. Those classic old films have become a staple of the Clayton Theater. Check out more about the theater from their website, theclaytontheater.com.
Next week, a unique art exhibit comes to Wilmington. Let's just say there is some international intrigue behind it. And have you seen this ship in Lewis? First Experience has the story of the floating lighthouse.
And don't forget, you can find Delaware news on the radio in Lewis on WHYY-FM. Check it out at 90.9 along Delaware's beaches. That is First for this week. We thank you for watching. For Alana Gordon, Nichelle Polston, and Shirley Min, who will be back next week, I'm Mark Eichman. Have a great week.
Wilmington residents can now sign up for free emergency text and email alerts directly from the Wilmington Police Department. The department can now issue alerts which will simultaneously call landline phones, send text messages and email, and post to social media. The service is free for subscribers and registration is easy. Simply text your zip code to 888-777 or register online at nixle.com, where you can customize alert settings and choose to receive email and web alerts as well. With Nixle, you know.
I love Wilmington and I love WITN.